Greetings, this is LaShonda Sale. I'm your instructor for this course, and I promised you a video so you know who this person is that's emailing you every week. So here I am in a video. I wanted to start today or tonight with just some of my background in research and why this course means something special to me. I have been in nursing for 25 years plus. And when I started in nursing, there wasn't a lot of conversation about nursing research. We understood clinical research and medical research and other disciplines, but nursing initiating research just wasn't a thing. And we talked a lot about case management. We talked a lot about bedside care and what we could do for our patients, but we weren't actually doing the process of measuring it and seeing what was most effective and how that can be changed. So I've seen a lot change over the years. If you're in this course and you've been nursing for a while, a lot of these terms are going to be foreign to you, and we are learning fast and furious, breaking down some of the terms and the types of research studies and how you analyze and critique. And it's a really huge, fast learning curve for some of you, maybe even for most of you. I would even guess that for some of you that came through your nursing programs recently, there wasn't a lot of emphasis, or maybe not even a separate course in nursing research. So some of this is still kind of new to you. So we're coming at it from that approach, the way we've designed everything. There's kind of a rhyme and a reason to it all. I've got my screen up here because I wanted to walk you through this next assignment. Where we are now, and I want to just highlight again this Ask the Instructor forum, because some of the questions I get in email are really good questions that a lot of people would benefit from. So I want you to pose your questions there as well. Now, in the first couple of weeks, we started looking at the different research designs. And in your first activity, you were kind of breaking down those 3 articles that are in the appendix of your textbook. The feedback on that one, for the most part, everybody got it. You know, you got your table, you're breaking down independent, dependent variables, what the research question is. Let's see if I can get that pulled up. The rubric for that, how it was graded. And you'll see those grades posted now. They should have been available by Monday. So you looked at what the problem is in each of those. I didn't see any major issues there. What the significance is. Where I saw some misses on that one were in relating it to nursing. Sometimes we'll look at a study on pain, but you really want to pull that back into what does that mean for nursing? What can we do about that? If we're doing a study on how aromatherapy helps in pain management, that's an implication for nursing, because that is an intervention that nurses can do at the bedside, in the homes, in the community, wherever. So look at those research problems that they're identifying: pain, opioid crisis, substance abuse. All of those are issues that are relevant to nursing, because there's a ton of things that we can do without additional orders or procedures or protocols, just in our education and in our nursing interventions. Hypothesis was pretty well laid out. Your variables, I saw that get flipped a lot. Your independent and dependent variables. So say I've got a study where I'm looking at pain, looking at pain management, and I've got one intervention, one case study group, control group, that's getting the aspirin for pain. They're getting the traditional treatment. And then my other group is going to get apples for pain management. Instead of the aspirin, instead of anything else, they're going to get this different intervention. In that scenario, pain is the independent variable. That's the thing that we're measuring, the effectiveness, the up, the down, the scores, the pain scores that are rated. The dependent variables are the variables, the interventions, the thing that the input that we do. So whether it's aspirin, giving them aspirin, or whether it's giving them the apple as an intervention to control pain, those are your dependent variables. So a lot of people got that flipped, and you should see some really specific feedback on your rubrics in that assignment. And then the sample pulling in the piece of describing the sample and is that sample appropriate. So we're kind of trained to think in quantitative studies, the more the merrier. If you got a sample of 1,500 people, that's more generalizable to the entire population than a sample of 5 people. In a qualitative study, the number is not as important, but it does, if you do want to be careful with trying to generalize results from a qualitative study, especially if that's a small sample qualitative study. So that was application activity 1. Activity 2, so then you had your discussion forum, and those are getting graded this week. Basically, in the discussion forum, let's look at that. I haven't actually seen, I don't have any feedback to give you on that just yet. What I think is going to happen. Oh, so this is the one where you got to report about your search. And the main thing I wanted to say about that is to make sure that you're asking for help. Doing this article search is a really important skill that you want to come out of this class with. So that tutorial that was on the other page about doing online searches, your library guides. We have one health sciences librarian that will help us. Sometimes I'll do a search and I'll put in a few different search terms. I'll get a few articles that aren't available in my library. I can actually email our librarian and say, hey, this is an article I'm looking for. Do you have access to that? And they can find things. They can just pull stuff out of the air. So don't let an article, a search go dead on you just because you can't access the full text of that article. Make a list of those, copy and paste those, and then send that to your librarian and let them help you, because that's what their goal is. Because that can be a really frustrating thing when you've got your search terms just right and you've even played with them, but you get a bunch of fluff or things that you can't actually read or access or analyze. So use your librarians for that. That was the main thing I wanted to say about that. Okay, so that was last week, or ended yesterday. This week we are going to close some of this down. Week 4. We're going to start to break apart the types of research studies and evaluate that. So there are certain things I want to study as a qualitative method, some things I want to study in a quantitative way. And there are a ton more research methods or research designs that you will find in your textbook and you'll find listed in some of the articles. But for the sake of this assignment, we're looking at qualitative and quantitative because I think that's what your 3 articles are, either one of those. So you're going to look first at the design. And let me give you the shortcut. If you start with the readings that are highlighted here, it's going to help you answer all of these questions. So, rather than trying to comb through each page of your chapter, we give you the shortcut there. First thing you're going to do is, this is still in table format like you did for application activity number 1, describe the research design for each article. So you're going to tell this is a qualitative study, or this is a quantitative study with double-blind, placebo-controlled, randomized, blah, blah, blah. So you're going to throw in all the terms that you can recognize. Now, sometimes when an article gets published, a lot of things get wiped out. So sometimes you may not be able to find, you always find sample size, and you'll almost always find the type of research design. You may have to comb and look for it. It may be in a term that you're not familiar with, but you should be able to find those things pretty early on in the research article that you're reading. Then you want to find out or describe how this design was useful to answer the question. So if I want to know how working third shift impacts sleep cycles in ICU nurses, I just want to know how it impacts the relationship. Then I'm going to do a qualitative study, because then I can put 5 or 6 nurses together in a room and ask them all the same series of questions and get their answers. I'll record that whole conversation, and then I'll look for themes in that research or in their answers. That'll be the data I'm looking for. But if I want to know if working third shift, how it impacts the number of hours of sleep, like that's a more specific quantitative question, then that's going to be a quantitative method or a quantitative design. And I'm actually going to give them like a sleep diary, record the number of hours, or I'll give them a scale. In the last 3 nights, please list on a scale of 1 to 8 how many hours you slept, or in the last 3 days, if they're working nights, they're sleeping during the day. So I can ask specific number answer questions that don't lend to any interpretation. It's just a 1, 2, 3, 4, 5, 6, 7, 8. And then I take their set of answers and do some averages and do some statistical analysis on the results that I got there. So if I want to know a specific measurable outcome, then I'm going to do a quantitative research design. If I want to know subjective responses to quality of life, perception of pain, impact of pain on your marriage relationship, those are all qualitative types of, now I'm getting my words mixed up, those are all qualitative types of research designs. So does your design match your question is what you want to go back and look at there. That's all still part of number 1. And then you're asking about the drawbacks to using that design. And that should be laid out in some of the reading there. A drawback for qualitative, for example, may be that there is a lot of subjectivity and you don't get any common threads. It may be that you have some dominant types in that interview group and they kind of run the whole conversation, or everyone tends to agree with them, and that kind of muddies the true measure of what's going on. Like you may have gotten a better, truer, fairer answer if you'd interviewed them individually. In a quantitative study, depending on the questions that you ask, so if you ask how many hours I slept, to me, as the one asking the question, that seems like a pretty cut and dry answer. But to you, you may say, oh, well, I slept 4 hours in the morning when I first got home from work, and then I slept 3 hours that evening. Does she want the 7, or does she just want the first 4 before my sleep got interrupted? And then people start to interpret, or, they'll start to change around their answers based on what they think the question is asking them. And you would think it would be pretty cut and dry, but it's not always. And I know that from being an instructor that, sometimes you can ask a yes or no question and get a lot of interpretation with that. So that's part 1 of it. Part 2 gets into the techniques used to collect the data. So I talked about with a qualitative study, you may do a group interview, you may do one-on-one interviews, you may do a survey like SurveyMonkey. Send it out to them, have them answer it, and send it back to you. So that's what they're looking for in that. That's what we're looking for in part 2, is what were the techniques used? If it was quantitative, what types of instruments did they use? Did they use a Likert scale, which is on a scale of 1 to 10, please rate your pain. That's a Likert scale. Or did they use, if they were doing a pain intervention, maybe they used a TENS unit. They still have to measure the outcome though, so that's probably going to be a scale. It might be a faces scale though, where they have to do the smiley face or the sad face to measure pain. So those are going to be some of those are going to be some of your instruments that you use to measure the outcome that you're looking for, which in that case, in that example, would be pain. So again, there's set of reading there. And then the last thing I want to hit on in my last minute here is APA style. I can't say enough. Use your APA book, like your hardcover, soft cover, paperback book, 6th, 7th edition, whatever edition we're on that's in the syllabus. Use that. Sometimes you're doing your Google searches, Google Scholar on the library site, and it'll give you copy and paste the citation. That's not always right. So you want to get really familiar with the book, because now that you start to turn in assignments, we're going to be watching that a lot more closely. You've probably had a lot of feedback on that. This is not your first semester, so you've had a lot of feedback on that already. So I'm assuming you're pros at this. So we will be watching this very carefully. So that's the end of my 15 minutes. I just thought I'd come in and just kind of give you an update of where we are right now. I'll have some access to email over the next 10 days. I'll be out of the country, but just be patient with me. I will be checking to see what's going on in the class and if you need me for anything. All right, you guys take care and we will chat soon.